Hello, welcome to the Medics. Today we'll be talking about breast cancer. We'll be defining breast cancer and the importance of detecting breast cancer early for better outcomes. And we'll also talk about the risk factors involved. So, breast cancer can be defined as an abnormal growth of cells in the breast. It can occur in both males and females, as some people think. It can occur in both, not only females. Okay, so breast cancer is abnormal growth of cells in the breast, and they multiply uncontrollably. So it is very important to detect it early for better outcome. When breast cancer is detected early, it can be treated. It is treatable. But when it is not detected early and it goes out of the breast, that is, we say it metastasizes, it goes to other body parts, then it becomes difficult to treat. So it is very important for women and even men to examine their breast routinely to pick up any abnormality early enough for management or treatment. So there are different types of breast cancers. We have some that are invasive and non-invasive. But this video is purposely for to raise the awareness of breast cancer for the ordinary person. So we will not go deep into the types of breast cancer. So what are the risk factors then? For the risk factors, the number one risk factor is genetic. We have genetic factors. And another one is family history. So if you have somebody who is a first degree relative, and by first degree, I'm talking about somebody you share direct blood with, maybe a mother, a father, somebody who is your sister or your brother who you have blood relation with. If the person develop breast cancer, then you are also at higher risk of developing breast cancer. Another thing is the age. So when it comes to the age, somebody who is an elderly person is at higher risk of developing breast cancer. Another thing is the hormonal factors, especially in females. For somebody who had early menses, that is we call it menarche. For somebody whose menses came earlier, say 10 to 12 years, 14 years, well, that person has a higher risk of getting breast cancer. Another thing is if the person has menopause late. Some people have menses even in their early 50s and beyond. So if you have such thing as a woman, then you are also at high risk of developing breast cancer. Some people also take hormonal therapy. That is, we take drugs that contains hormone, estrogen, progesterone. So those on drugs containing hormones, that's hormonal therapy, they are also at higher risk for getting breast cancers. Another thing is our lifestyle, the diet, exercise, and smoking. If you are involved in, say, you eat anything that comes along, you become obese, and you don't exercise, all these things increases your risk of breast cancer. And if you don't take care of yourself such that you smoke, you drink alcohol, all these things are factors that uh, predisposes you to breast cancer. Now let's come to the symptoms and detection of breast cancer. The commonest symptom of breast cancer is usually a lump, which may be painful or not. You may have some nipple discharges, and it could be any whitish substance or bloody. All these things are symptoms of breast cancer. I must also emphasize that for this part, those who have menses may also experience some sort of lumps in the breast. and they may also have some mild tenderness in the breast. So you have to steady yourself and know that this is the normal thing that happens to me routinely on monthly basis. And after the menses goes, it also vanishes. This is normal. But when it is there throughout, it doesn't change, then you know that this is something that needs attention. So when it comes to diagnosis of breast cancer, usually you complain to your doctor will take a good history, and then he will order some lab tests and do some imaging studies, mostly ultrasound and mammography, depending on your age. After he makes the diagnosis, they will usually tell you the treatment options depending on the type and stage of your breast cancer. And we have surgery, we can have radiation therapy, we can have chemotherapy, we can have hormonal therapy, we have some targeted therapies and also immunotherapies. This will be chosen based on the type of cancer and the stage of the cancer. So let's talk about how to prevent these things, how to prevent breast cancer in general. So it is better for us to do some regular screening to detect it early if it does come, so that we will treat it. When detected early, the outcome is usually very good. And that is why we encourage people to do routine examination of their breast, both males and females. Okay. The next thing is our diet and our lifestyles. You have to make sure that you eat good food. And by good food, I mean food that contains less junk. We take a lot of fatty foods that are junk, and it is not good for our body. Another thing is for us to stop or avoid smoking, taking alcohol. All those lifestyles are not good. And also do regular exercise. This will help prevent breast cancer. So, in summary, we've talked about the what breast cancer is. We've talked about the risk factors involved, and we've talked about the treatment modalities. This brings us the end of this video, and I'll encourage you to watch my other videos on diabetes and hypertension and lower back pain. You can find all of them in this channel. Thank you very much for your attention. Please do subscribe and share. See you in our next video.